Let's talk carpal tunnel syndrome. Hello everyone, I'm Joe Basichia, along with Dr. Eric Strauss. He is Chief of Hand Surgery at Virtua. Good to have you with us.
Glad to be here.
You always like to say the hand, well, that's the most important instrument that we have.
That's correct.
So when it comes to carpal tunnel syndrome, what is that and how can it become debilitating for people, especially if they don't take care of it?
Carpal tunnel syndrome is a disorder of the nerves and tendons of the hand and forearm. The tendons swell, they push on the nerve, and the nerve malfunctions.
So where does it hurt? Does it hurt throughout the hand?
It hurts mostly in the wrist and hand area with numbness and tingling in the fingers.
People may notice this is happening. Do they just think, you know what, this will go away? Or should they see a hand surgeon like Dr. Eric Strauss?
Sometimes it's self-limited, but for the most part, if it exists for a month or two, they should see their family doctor and then a hand surgeon.
Well, what can you do about it?
Well, treatment for it involves several things. First, you have to look at the cause. A lot of times it's from a repetitive hand activity that people do either at work or at home, and that could be altered. A lot of times it's just one of those things that we get. So the treatment for that is to come see a doctor who can put you in a splint, perhaps give you a steroid injection to help, or send you to therapy.
How about advancements in the treatment of carpal tunnel syndrome?
Well, if conservative management, such as therapy and splinting, don't help it, then surgery is indicated, and we have minimalist surgery that takes just 5 minutes to do and gets you back to using your hand that day and driving the next day.
You know, let's get back as we finish up here to what we started at the beginning. You said it's the most important instrument. Think about how far we've come through evolution with this. Now we are dealing with other issues, computers, all of this. There's a lot of stress on our hands.
There is. We haven't evolved as quickly as our technology, so our hands are still suffering because they think we're in the 2000s and the 1900s.
Well, the good news is you have technology advancing to treat it, so thank you so much for being with us.
Thank you for having me.
He's Dr. Eric Strauss. He's Chief of Hand Surgery at Virtua. To learn more about Dr. Strauss or any of our physicians at Virtua, simply go to virtua.org.